Welcome back. The New York Foundling works to provide mental health care to New Yorkers by providing carefully designed programs, effective and interrelated services, and opportunities for community members to create transformational change in their lives. Joining us now to discuss their efforts is the Senior Vice President of Mental Health Services for the New York Foundling, Dr. Kristy-Lee Jean Pierre. Doctor, thank you so much for joining us.
Thank you. Thank you for having me.
Now, can you tell me a little bit more on the overall mission of the New York Foundling?
Sure, yeah. So for over 150 years, the Foundling has been committed to supporting hundreds of thousands of children and families and adults throughout New York City and Puerto Rico. We offer a single point of entry, or what we like to call a front door, just to allow ease of access to a lot of our services. So I specifically oversee our mental health department. So I oversee the mental health provision for our children that are in our child welfare, as well as children that are in the community at large, and through our school-based mental health program as well.
Now, I understand that you offer a wide range of services, as you mentioned, from child welfare to mental health support. Can you share a little bit more about some of the key programs that you provide?
Absolutely, yeah. So as mentioned, right, we provide mental health services. But we also provide medical services. We also support children and families that are involved in child welfare, as well as preventative programs. We support adults that experience developmental disabilities through a wide array of services that range from day hab services all the way through supportive housing services. And we also provide educational services, again, ranging from pre-K, actually, all the way up through college, through our Fostering College Success Initiative. So really, we kind of have our hands in a lot of different pots, if you will.
Now, with that, focusing on so many different issues, how do you kind of ensure that the communities that you are serving are being well attended to while you're focusing on these different issues?
Oh, good question. One of one of our main concerns and our main drives is using research, right? You researched back data, really thinking through and using things that we know that works, right, for the families that we're supporting. All of the services that we provide are trauma informed, and we try to be responsive to the needs of the families that come and seek care with us. And so, as I mentioned earlier, right, we want to reduce the barriers towards accessing some of those services that we provide. So, for example, if we happen to have a family that maybe started with us through child welfare, right, then perhaps after they have separated from that particular service, they may continue to still seek mental health services with us, or medical services, right, through one of our community clinics located in the Bronx, actually, at 170 Brown in the Mott Haven section. Additionally, if they have a family member perhaps that's experiencing developmental disabilities, then we're able to connect them to that arm, right? So we really try to be responsive to the needs as they come up, and try to also seek to have those responses be really individualized and unique, because we know that the needs of folks, right, tend to be unique. They're not cookie cutter, and so we can't be either.
Now, I kind of want to merge these two ideas. So, the work that you do with children and mental health, I understand that there's a school-based mental health program. Can you tell me a little bit more about that and how it works?
Yeah, so we actually are currently in over 20 schools throughout New York City. We are offering services, or at least have them available to over 20,000 children, again, through all the 5 boroughs. And why that's really important is because if a child is identified perhaps through a crisis event, right, that they need additional support, then they're able to be referred over to us. Additionally, those services may be provided either in their school, we may be able to provide them at home, right, through our telehealth services, or we have another brick and mortar actual office that they can come and seek those services. So we have a community mental health clinic that's up in East Harlem. It's at 109 115th. And the really great thing about that is because it's off the 6, it's actually really accessible to our Bronx locations as well. Like I mentioned, one in Mott Haven and then another one up at Southern Boulevard. So the students are not only being able to access crisis services, but also individual treatment, group therapy, medication management if they also require that, as well as any evaluations to support with housing or educational needs as well.
Now, what are some of the biggest challenges families and children in New York are currently facing today, and is your organization helping address that?
Yeah. Even before the pandemic, we were seeing a rise in acuity and a lot of the presenting issues of children, and that was ranging from depression, increased thoughts of self harm, behavioral disruptions, and all of that has continued to persist throughout and since the pandemic. And so, what we've been trying to do to ensure that we're addressing that, one, like I mentioned, is really trying to minimize the barriers. Right, when folks are looking for help, they don't want to have to jump through a million hoops to try to identify, right? Where can I go? Who takes my insurance? Who has availability? And what's great about us is we don't allow insurance to be a barrier to being able to provide those services, right? And so, given that folks are concerned more than ever about their finances, right, about being able to access enough food and stability of housing, being able to address all of those needs in one place really helps to minimize the stress, which then is going to impact the outcome and make people, get better faster.
Now, speaking of stress, I have to mention that we are kind of within the holiday season right
Oh,
now.
yeah.
How does that impact the stress that many of these same families are kind of facing already?
Yeah, I mean it's really unique depending on the person, obviously, right? So, a child, for example, entering child welfare may be experiencing their very first holiday separated from their family, and that can be really tough, right? Similarly, so some adults experiencing developmental disabilities can feel really isolated and not really included in all of the festivities and the parties and whatnot, right? So we definitely see an increase all across the board. In folks' stress levels and their concerns. And so, in addition to just treatment, we also try to support with community building because we know that those are the kind of strategies that also supports during these times, both for children and adults. So, having holiday events, right, having giveaways, being able to connect with people without all of the initial tensions of stigma or worry that I may be being judged for any of the presenting issues that I have, that helps a lot. And so we try to focus on, again, just identifying different and unique ways to actually get folks what it is that they need and supporting them connecting with each other.
And focusing specifically on, the children in foster care who you mentioned, this could be their first time not celebrating some of these holidays with their family. Even beyond that, what are some ways that you support that, vulnerable community?
Yeah. So, as mentioned, right, we try to definitely use trauma-informed care so that we're ensuring that we are sensitive to a lot of the unique needs and concerns that our children and families are experiencing so that we're not re-traumatizing, right? We're not causing more harm when folks are coming and looking to us to actually help. Additionally, we try to be really unique about how we are tailoring those services to folks. Again, it's not cookie cutter. We can't just give, one size fits all to everyone. So not everybody likes individual therapy. Not everybody wants to talk about their feelings. So being able to have additional programs where we utilize art healing, right, for folks that are not particularly interested in just speaking about their feelings, right, offering different modalities of having folks meeting in groups, having folks meeting via telehealth, right, to again meet them where they are, really helps for us to branch out, right, and again increase that access for folks and lower a lot of the stigma that folks tend to feel surrounding getting this type of help.
And I love that you mentioned that because you're right, absolutely. Like somebody who may just be experiencing this for the first time may not want that, type of attention
Yeah.
or to talk about those type of things. So I think it's amazing that you're kind of looking at it from every different angle. Can you quickly just let us know, just moving forward, what are some of the organization's goals to continue
Yeah.
helping this community?
Oh, for sure. Well, expansion, right? We definitely want to help more families. We want to get to the places that we aren't currently located. So currently, right, and that it seems like a tall order because we're already through all 5 boroughs. We're in Rockland County, Orange County. We're also provide services for folks out in Puerto Rico. So we're definitely an expansive program. But as anybody who lives in New York City knows, there's a big difference between Mott Haven and Kingsbridge, right? There's a big difference between downtown Brooklyn and Crown Heights or Canarsie, right? So being able to actually expand into some of those areas where we know folks really need it where we know that folks would also really respond to it is definitely top of mind. And then also looking at additional innovative ways, because that's always been our major goal at the Foundling, is being innovative, right? Being on the cutting edge and really trying to identify the new ways, the better ways to help our community. So partnering with as many people as possible that we know are already doing this wonderful work and seeing how we can tap into that network and see if we can add any value to it.
Well, I want to thank you so much for joining us. Your organization is doing amazing work, and for being around for over 150 years, you have to be innovative. So thank you so much for joining us and sharing a little bit about what you're doing to help New Yorkers.
Yeah, thanks for having me.
To learn more about the services they offer, please go to their website at nyfoundling.org. Stay tuned. We have more for you right after this.